what's been happening and these reports that we've heard of. Now the nurse herself has decided to go to court.
Yeah, I think it's quite an unfortunate development to start with. And for me, this issue is like a coin. It has two faces. First of all, if you look at what happened at the hospital, it's highly condemnable because there is no justification for anybody walking into a hospital, whether physical or verbal, to attack or hold such a kind of attacks on a nurse. So it's condemnable. And the other side of it has to do with the attitude of health workers and, quote unquote, the kind of public perception people have about health workers in Ghana. For me, if you zoom down to what happened at Rage Hospital, I think there was a bit of lack of communication that ensued and gave rise to some of these things. Because at the heart of nursing training and medical training, there is something that we call establishing a rapport with your patient. Communication is very key. So listening to Ralph's account, when he went to the hospital, a particular nurse came to her and then applied bandage. When you are involved in RTA, one of the best treatment that you can very often get is arresting the hemorrhage. So that is exactly what was done for him. It means that within the emergency setting, something was done. But maybe the nurse failed to reassure him by communicating that, gentlemen, this is something that needed to be done and it has been done for you at this time. So wait, subsequent treatment will be offered. For instance, maybe you might want to take X-ray depending on the extent of it. Maybe the person has lost blood. You might want to take a sample to go and do full blood count. Maybe you may be waiting for a doctor to come and take a second look at the person. So if this break in communication happens and the person sits there, he might be thinking that nothing has been done. And again, there is this perception of, I went to the hospital, the nurses were not looking at me and those kind of stuff. You see, at the emergency settings, there is something that we call triage, depending on the severity of the condition that you came with. So somebody, you might come before somebody or somebody might come before you. But
depending on your case.
Exactly. So when they triage you, we have this yellow, green, red, depending on the severity, the person will attend to you based on. So they may be on you. An emergency situation may pop up. That is very, maybe, very...
Are we not substituting that for poor service delivery? No. Because some people go to the OPD or wherever it could be, emergency ward. You get there and no one is even talking to you.
So that is the communication bit. That is the communication gap. That has to be, improved on. For that one, that is understandable. But I'm saying that there is this general public perception out there that nurses don't care when you go to the hospital. So the care is dependent on the severity of the condition the patient come with, you understand? So the person might want to prioritize who needs that immediate care. And some of these healthcare infrastructure deficits that we have, you go to the various hospital, ask yourself, if you look at the ER section, how many nurses do we even have at a time taking care of patients? So I think there is the other side of it and then the other aspect of it all. But it's quite unfortunate that people have taken this whole thing. There is still some kind of emotional connotation in this whole aspect.
You feel we shouldn't be emotional when people have had similar experience in the hospitals? I mean, many of them sharing their accounts. You just said, could you also tell me that? Look,
but the
he was frustrated to the point that he had to move out of the hospital.
the case is, I'm not discounting the experience that he went to. What I'm saying is that, you see, issues like this to bring into the argument, what can we do to improve healthcare in general, you understand? Rather than, because I listened to some commentary on TV where some people were hurling some kind of unprovoked insult and attack on healthcare personnel, those kind of stuff. You see, we need to admit the fact that there are challenges in our healthcare delivery system and that there is a need for us as a country to improve upon service delivery. You understand? As we speak, most of the nurses working at our hospital, some of them have one leg here, one leg in the UK because of the way our manner, the service conditions.
And because they'll get more money when they get to the UK.
So the mind itself is not here. So I think this should give us some kind of a ground just to make sure we improve on healthcare delivery in this country. And for the nurse heading to court, I think that is her prerogative. If you suffer one form of attack, or you have the right to seek legal redress in any way that you think.
Because you wanted to chip in something
let's quickly. You see, reality drives perception. Let's not make it look like it's a perception. Let's just oppose public hospitals and private hospitals.
Could you like, this is payback time for the nurses?
No. But look, what we are talking about is only in public hospitals, not in private hospitals. These things don't happen in private hospitals. Go to Nyaho and see the services that you get in Nyaho. Go to any private hospital around the world and see the service you get. So we are not even talking about the full spectrum of healthcare in Ghana, where it's bad for all nurses. No, it's only in the public hospitals. Why is that? So let's not make it look like all nurses are bad and all nurses in healthcare delivery in public hospitals are bad. But majority of the problem is in the public hospital. Thank you.
Tony, you want to... Ralph St. Philip is now becoming a darling boy for the NDC.
I'm not sure. Ralph has been an activist, and I think over the years, some of the things that he's done, people are quite privy to some of the things that he has been doing. So for me, I think he was doing one of his many things. Yeah. It was unfortunate it got into the excesses, and I think we've all condemned these things, on certain terms. My younger brother made reference to nursing training. I think nursing training in Ghana is one of the best in the world. That is why Ghanaian nurses fit into any particular space. For instance, if you're a Ghanaian nurse and you are traveling to UK, you don't write any exams in the field of nursing. What you do is just write the IELTS. In America, you only write the NCLEX. Once you pass, you fit in. So they are best trained. But the issue has to do with...
that good out there. How come, when you go into a Ghanaian public hospitals, the feeling is not
the issue has to do with attitude. And some of these things, if you zoom into other entities like the bank, you might one way or the other gone to a bank and somebody might have treated you the same way. You go, somebody maybe on his phone sometimes. So I think, you see, very often when the issues pop up like this, we very often fixate on the emotional aspect of it without finding a common ground and building a solution. For me, I have always argued that I know some foreign companies in Ghana, once you enter into their premises as a worker, you leave your phone somewhere. You only take it on break or maybe after work.
You feel we should do that for us?
I think we should, because
take away their phones.
Exactly. I think and pay allowance for that, because I think that very often. Yes. Because
allowance. For, allowance.
But we've got to the extent people are asking for. We've gotten to a set of people asking for height allowance and so. So it's definitely. I'm saying what will probably come up.
What you're saying is,
they should leave it in their locker.
We pay nurses for keeping their phones away.
I'm just making a point that people were making demands for height allowance. So definitely, if you ask them to put down their phone somewhere, they will be. That is not what I'm stating. So that is the point. But so far, I think I like the way the minister has conducted himself thus far. He has shown some competence, and because in the midst of all these attacks, he has been able to compose himself, looking at the demeanor amidst of those unprovoked and unwarranted attack from the General Secretary of the GRNA. And I think it was quite unfortunate. Wherever he is, he should gather the courage and apologize to the minister, because such attack is totally uncalled for. Because as a leader of an organization like professional nurses, you should not be seen in public space going that particular kind of line. I think it's quite unfortunate. So these are stakeholders. And I think if we can improve on healthcare, it will come as a result of this multi-stakeholder engagement involving nurses, minister, and even the public. So it should not be seen as, oh, you are there as a minister, do it and let's see. If we do that, we don't get anywhere, you understand? As we speak, if we collaborate in this particular manner, we come to the realization that there are a lot of things that we need to do to improve healthcare in this country. And once we do that, it will benefit everybody. But if people begin to see the other guy as you are the one responsible, just do it and let's see. And the argument of the nurse being likened to a farmer was quite unnecessary, because you see, there are prominent farmers in this country. The president himself is a farmer. I'm told Otumfuo himself is a farmer. So you see, such denigration and stuff, you don't do some of the. There are prominent. Oh no, most of them. Some of them
their own farms.
Yeah, their own farms,
but doesn't make them farmers.
But so that is it. No, but once you own farm, that is it. You understand? So I think that is the kind of assertion we shouldn't be throwing out there for people.
Yeah, you think we shouldn't belittle farming?
No. And yesterday the association issued a statement asking him to apologize and retract everything that he said. You understand? I think it was quite denigrating, especially coming from a professional who should know better. It was quite unfortunate. I'm still expecting that he will do the needful and see the minister as a partner, and that they can collaborate to improve health.
Because of time, I see that there's so much interest. Gentlemen, just hold on for me.
Over 2 decades now, apart from Okoboy, who served, I think, 6 months. We've not had a medical doctor serve as a minister.
Okay, gentlemen, you know what?
Briefly. That's what I said for 2 decades.
Here's what we'll do. You are really coming hard at the GRNMA. Ivan, just do your take. Let me get online and take those online on the next issue.
Sure. I think the whole essence of this conversation must gear towards a particular resolution that will aimed at addressing the many challenges that we have. You see, the healthcare is such that one way or the other, everybody is a bit entangled, because one way or the other, whichever way, you might become a patient at any point in time. So I think we should see...
But you see the comments, and so many people, I mean, almost everyone having issues.
Yes, but I think we should seize the bastardization and look at a common ground, how we can improve on quality care. Because, like I said, every one of us at any point in time may become a victim. And the sad aspect is you only become a victim in your lowest moment. And these are the people who will be taking care of you.
When you don't have the power
to do anything. You may be the richest person in Accra, but at that particular moment, you are in your lowest element. And that is when you go through some of these things. So this is an opportunity for us, just like my younger brother said, to reflect and see how we can improve on care. And the various stakeholders involved must engage and have this multi-stakeholder dialogue, how we can improve healthcare. Because the kind of public perception about nurses is some way. And I think it's quite unfortunate, and we must do everything to ensure that we improve healthcare. And the sad aspect of it is there is this angle that we should also look at. Very often we spoke about allowances and stuff. I know doctors who are doing their housemanship. Some were posted somewhere last year, and they've been working for 1 year. They've not been paid a dime, but every day they're expected to go to work. You understand? So in this whole conversation, I think we need to look at all aspects and look at how we can improve, because they are also human beings. The nurses are not some isolated individuals who just join us in this country. They are part of our society. They are our brothers, our sisters, but the situations and the conditions, some of the things that has necessitated some of these things. So I think the conversation should not be some sort of an adversarial conversation where we seek to impugn or denigrate them, but rather we must stifle a conversation that will seek to improve healthcare, because we are all stakeholders. One way or the other, you may become a patient, and I think that is what.
And I love what you say about the moment you need the nurses. That will be at your lowest point, so you may not even have the strength to talk or energy to talk. Let's go online. Shamima, I understand you just want to deal with something briefly in a minute, then we move to the presidential jet, because Nana Poku is being with us.
I'm happy we all agree that we are truly all involved in ensuring that we have a safe and sound health sector. It means the stakeholders within the health sector working together towards that goal. It means that an involved minister who moves away from his office goes around to ensure and to find out what is happening towards the intention of finding long-lasting, solutions to our shared problems. It also means that, again, not playing unnecessary politics, but to also put the facts out. I think Kojo was a bit riled up this morning. The point I sought to make is that we cannot question the commitment of President Mahama to the health sector. Because when he had an opportunity, he did a lot of things. These are not contested matters. And he started the presentation by saying, I said the 7 months. How can I say plausibly that 7 months we have had infrastructure more than the 8 year? The point is that, and the fact of the matter is that, in terms of health infrastructure, the Mahama administration, going back to the Mills administration, because the UGMC project started under President Mills. The Mahama administration started.
That's where he gets agitated when you're leaving out his administration.
But is that necessary though?
Yes, it is necessary.
In the conversation we are having, is that infrastructure conversation necessary?
Communicate. It is infrastructure problem and resourcing problem. Or you have not heard the nurses. You haven't heard the nurses who are home crying to be employed, and there's
so complete the agenda 111.
Infrastructure to be employed.
So complete the agenda 111.
Contest that.
Complete the agenda 111.
Complete. As of 2016, we had absorbed all backlog of nurses in the system. Kojo, why can't you tell us?
But so complete the agenda. So why complete the agenda 111?
Bottom line is that there is a government that is committed to our healthcare workers.
So let's move on.
That government will do all it can to ensure that we solve as many of the contrived, it's not even contrived, complex problems that the health sector faces. Because again, we will all be health seekers one day. And it is in our interest to ensure that they are well resourced, they are well motivated, and they are well sheltered in their line of work.
Okay, because of time, apologies to all of you. We'll do the next round, so of course some of our student leaders can also have their take. Let's do this, because Nana Poku has also been on for a very long time with us. He's here to comment on the presidential travels. Probably when we're doing the next round, maybe because you could come in with a rebuttal on that for the sake of time. You don't want to comment on that again. Okay, so here's what we'll do. Let's move into the presidential travels, because we know the president is not in the country. He's on the second phase of his presidential tour to Southeast Asia. He's done Japan. He may be moving to... Oh, he will be moving to Singapore, we understand. Okay, but there's a group, the Trade Advocacy Group,